Good morning to all. My name is Sukharpreet Kaur and today I'm going to share my capstone's topic, which is conflict management. Conflicts can be described as a serious incompatibility of two or more opinions, needs or drives, or serious and often protracted disagreement or arguments. There are a number of factors that lead to conflict in a healthcare settings. For example, differences in individual needs, interests, or values. Conflicts among nurses has a detrimental impact on the retention of qualified staff and patient outcomes. It then results in tense situations, false views, challenges in accomplishing the goals. There are types of conflicts. The first one is information conflicts. When there is a different or insufficient information available or disagreement on what information is relevant, this can be a very frustrating situation in health and social care because it can heavily impact on the care provided and those implementing it. Lost or missing medical notes, information missed of a prescription, and a poor handover are all common examples of this conflict. The next is value conflicts. Incompatible belief system or trying to impose a personal values onto others. Values do not tend to be negotiable, and this can often lead to conflict between the member of staff and whoever they deem responsible. The third one is interest conflicts. Competition over needs and resources such as money or time. Service users, patients, or their relatives may feel their needs are more necessary than those of others, and they may feel time given by staff is not being justly divided. This can cause conflict between the several parties. Relationship conflicts, negative emotions, distrust, misconception, or poor communication between people. The reasons for such conflicts can be many, as stressful environments and emotional situations can breed these emotions very easily. The last is structural conflicts, oppressive behavior towards others, a lack of resources, opportunities, and the structure of an organization. Health and social care organizations can have a high turnover of staff when working in a demanding role. Often with staff shortages and high demands, it can be very easy for conflict to arise if they begin to feel undervalued, under-resourced, and are not provided with support and opportunities for progression. So here are some of the barriers of conflicts. First is getting defensive. It is natural reaction for all of us to get defensive in the face of conflict. The problem is that when you become defensive, you are effectively adding fuel to the fire. Your defensive response will only fan the flames in the other party, while also limiting your ability to really listen to and understand the other person's perspective on the issues. The second one is dismissing the topic as an unimportant. If somebody comes to you with a conflict and they are venting their frustrations and you respond in this way, you are dismissing the topic as unimportant. If it's important to them, it needs to become important to you. It is important for you to know this. Feelings are neither right or wrong, they are simply information. You should never say something like you shouldn't feel that way. The third one is jumping to conclusions without having the facts. Jumping to conclusions can stem from our defensiveness, particularly if the conflict is about us personally. It also arises when you are mediating conflict. For example, when two employees are in conflict, you need to make sure you don't jump to conclusions before you get the other side of the story. The fourth one is an inability to emphasize with others. Some of us just naturally find it hard to empathize with others, particularly in a conflict situation where you know the other person is in the wrong. However, your empathy for the another person has nothing to do with whether they are right or wrong. You're simply signaling to the other person that you have heard their side of the story and you understand that they are feeling this way. The last one is inability to stay calm. There are always those times when things just explode and the conflict becomes to escalate. People are raising their voices, becoming more aggressive and shifting into attack mode. But you must maintain control and make sure you never lose your cool in these situations. This is perhaps the most damaging barrier that you could put up in resolving conflict. So here are some solutions to this problem. First is communication. Communication has a big role to play in conflict management. It has been observed that poor communication always results in misunderstanding. Our communication has to be clear and precise to avoid conflicts. The second is acknowledgement. Sometimes acknowledging the other person's point of view and any fault on your part is the first step to understanding. Focus on the problem, not the person. Remember, addressing the problem is the key to resolving it. Do not attempt to focus on the person as they may feel attacked. Actively listen. There are times, especially in high stress situations, when sometimes someone needs to release of their frustration, where this act can often make the negative feelings pass and allow more calm discussions and resolve to take place. Be aware of the emotions. Emotions can play a large part in conflict. Be empathetic when needed, and no emotions can make an easily resolvable issue seem much greater.